Today, the 27th of August, makes it 6 months that the first case of COVID-19 was detected in Nigeria.
It's been a war against one of the worst pandemics that the world has ever witnessed. Lagos State remains the epicenter of the pandemic in Nigeria, recording a total of 18,035 confirmed cases so far.
And still in Nigeria, the NCDC recorded 221 cases of COVID-19 overnight, taking the country's total number of cases to 53,021. Plateau recorded the highest number of new infections with 60 new cases, followed by the Federal Capital Territory with 33 cases.
Other states with high numbers include Kaduna with 26 new cases, Rivers State with 18, while Lagos recorded 17 new cases. So far, 40,281 people have been discharged, while 1,010 people have died from COVID-19 complications. Joining us in the studio is a COVID-19 survivor and TV host, Your View TV host, Nyma Akashat-Zibiri. Good morning, Nyma. Good to have you on this side. Nice to see you on this side. It's good to have you join me. I've joined your show, so it's good to have you join me now this time around. This is nice.
Absolutely. Today we are celebrating or commemorating, let me use the word, 6 months since Nigeria had the index case of COVID-19. You are a survivor, and we must say congratulations.
Thank you so
because we have recorded a number of deaths, but you were able to survive, and that is why we use the word survivor. But talk to us, if you could help us relive the experience you had when you realized that you had COVID-19. What were the symptoms? What was running through your mind? What was the experience, basically?
Okay. I was basically asymptomatic. I only lost my sense of smell. I could taste well. I didn't know. I had lost my sense of smell in the past due to other flu symptoms, and I didn't know it was COVID. But my husband was contact traced, and he tested positive. And not long after, the symptoms started to show: some shortness of breath, weakness, diarrhea, everything in the book. In fact, the day we went to do his confirmation test, I had just given him the ORT solution, the sugar salt solution, to give him some strength again before he could drive. And we went there as a family, myself, my kids, and my husband, and we all tested, our samples were taken. My kids were negative, fortunately, but I tested positive and he tested positive. And immediately I took that test. I didn't wait for the result. I just stopped, any further public appearances, because apart from coming to the station, I didn't have any other appearances I used to make. I made sure my house was neatly locked, no visitors allowed. If you had to come in as a family member, you had to do the routine hand wash and all of that. So we stayed home. We went, and they said the viral level wasn't high enough for him to be isolated at the center, and that the place was fully loaded at the time. It was at the height of the spread in Lagos, community spread in Lagos at the time. So we were sent back home, and he was told to isolate at home, which was difficult because the house is a bit small. So I simply just put the kids in one room, and we stayed in the other because I was taking care of him. And we wore the face mask. I wore the face mask going through both parts of the house. And as we got back home, things just started to get from worst to worst. I saw all the worst symptoms I didn't expect. The shortness of breath was the most scary of everything, because I would, you see a usually very energetic person, so weak he could hardly raise his hand, and then at some time he would be, complaining that he couldn't breathe well. And, unfortunately, we don't have a cure for COVID, so there was really nothing I could look up to. The doctors had said, just stay on vitamin C. But what about the symptoms I was seeing? So I treated symptom per symptom based on what I would do with my children normally. So per shortness of breath, I would force him to do the steaming, the traditional thing I know. I would, give him
There are no medications?
Apart from, nothing was given. Nothing was prescribed. We were just told to stay on 1,000 milligrams of vitamin C back at home. But then he got home, and, he started to show more symptoms, especially the diarrhea. He would, stool, and he would be so weak, he wouldn't be able to get from one room to the other. And, I had to be constantly doing the sugar and salt. Then every 3 hours, he would be on hot steaming tea, herbal tea. I didn't do anything foreign. So herbal tea, I would juice everything myself and, you know, serve him, especially the garlic and ginger mixture with the turmeric. I did all of that with my hands and, you know, did the juice.
So that was what sustained all of you out of it?
That was what sustained both of us, because my children to date are the earliest children I've seen. You know, they've not shown one symptoms, they've not had, you know, maybe basically because immediately the lockdown started, they never left the house. They were, you know, locked in, but both parents were working, essential work, you know, that we do.
So how are you able to manage, take care of your husband and the children at the same time to ensure that the children were not infected?
So it's very important to isolate. You know, COVID, at the time, I believed very strongly it was here, so it wasn't something I would take with levity. The children were strictly in a separate room, especially my baby who would like to sleep with his dad, but, you know, stay in a separate room, and then anytime we had to interact, we will have to be on the face mask. And the children, you know, as much as possible, limit what they come over to do. You know, with children, once they have a TV in the house, they would stay with the TV. So that was one of the baits I used to keep them apart.
Nyma, what would you say to people at this, even as at today, this week, where despite all the news, despite all the enlightenment campaigns, despite all of those, there are people who still say COVID-19 doesn't exist. What do you say to them?
So I've done my study. I live very close to a very major market, so I know that, you know, a lot of people do not want to believe, but they know that there's COVID. Okay. They've seen signs, but everybody wants to reduce it to something curable. And I think that, you know, faith is what is helping Nigerians. With what I have seen, we've gone past the stage that, you know, Europe was some years back where there was a widespread, but we are people who, I think, we have this level of, you know, maybe our genetics. Something must be in this side of the world that is helping us. And, you know, a lot of people just want to rely on that what will I eat? Because our government really, we do not have a clear strategy of how to help our people out of this. It's about
so if you place your experience side by side, the 6 months so far, from what you're saying, what would be your evaluation of how we have fared as a country in dealing with this?
Yeah, I'd say you know, the Nigerians believe that we have God, and I think that's what's working for us. Because basically,
the God factor.
What I believe is that we do not have a clear strategy. A lot of people have gotten infected and gotten cured, and they did not even know what hit them. I know the number of calls I've gotten on since I declared I had COVID. People asking, what methods did you use? People come online, have a lot of you know, direct messages asking, what did you use? What did you do? I have a friend who, for 3 weeks straight, lost his sense of smell and taste, couldn't leave his house, and he was calling for what I used. He refused to go for the test. So a lot of people have those fears and refuse to leave their houses and, you know, resort to self-help, and they're better. Wow. So we really do not have a clear strategy.
It's not a death sentence.
It is not.
That is what is important.
Yes.
But people out there should know that COVID-19 is real.
Yes.
That's the message from Nyma this morning.
Nyma, thank you so much for speaking.
Thank you so much for your time.